Great. Okay, everyone, welcome again to Cancer Bridges General Weekly Group. We are thrilled to have Mrs. Leah Northrop, and she is a licensed professional counselor. Leah splits her time between research at UPMC Center for Integrative Medicine and clinical behavioral health at Western Wellness, which is an outpatient practice at UPMC. She is currently coordinating 4 integrative medicine studies, including acupuncture for cancer-related pain. She also sees families, children, and groups for psychotherapy. Leah has worked in clinical behavioral health and educational settings for the past 15 years, where her focus has been using complementary practices and mindful approaches for well-being. Leah lives in Squirrel Hill with her husband, and her and I are kindred spirits. We both have 3 boys. So there's a sainthood, I'm pretty sure, for us.
Yeah, I don't know if everybody else heard that, but I do live with 3 boys and my husband. So four guys.
I forgot. That's right. We have to count the 4 guys. That's for sure.
Yeah. No, you just blipped out, Wendy, on my computer. I just, I don't know. That's like a badge of honor for me somehow to make sure everybody knows that I have that many. So thank you so much for having me. Am I allowed to say the familiar face? Am I allowed to say hello from here? Can I say, Joanne, hi? I'm so happy to see you. So I am really excited to be talking to you today. I do, in the end, have an ulterior motive, which is to introduce you to one of the studies and find out if it would be appropriate or something that you're interested in, all of you. So I wanted to just kind of disclose that up front. But in the meantime, I would love to introduce you to all of the good things going on at the Center for Integrative Medicine. First, I know that Wendy gave such a sweet but very professional introduction. So I just wanted to take a moment to introduce you to me in maybe a more personal way. I have been around the block. This job that I'm in right now is sort of a wonderful combination of all the things I've been interested in over the last 20 years. And my jump into the world of integrative medicine actually began with one of your very participants here. Joanne was my yoga teacher trainer. She taught me in my first teacher training. So I think that's such a fun connection to have. So thank you so much. I come also to the world of cancer and caregiving through my family. My mom struggled with ovarian cancer for a short while, unfortunately, and I continue to be a caregiver to, yes, my 3 boys, but my oldest son has many disabilities and spends a lot of time in the hospital. So I'm familiar with the medical world. In fact, I just learned how now to use a Broviac port. So a medical port where you attach TPN. That's been a really eye-opening. I think I'm going to take the nursing boards. Everyone, do you feel ready as well? I think we could all pass those and up our hourly rate just a bit. That's what I'm thinking next. I'm just joking. So I'm here from the Center for Integrative Medicine, but I'm actually coming to you from my office at Western Wellness, where I work with kids and families on behavioral health. And so this combination job that I have has offered me the opportunity to see people in lots of different spaces and to try to bring some of these practices to people in lots of different ways. And the Center for Integrative Medicine does that so well. And I want to make sure to introduce the center to you to start off. But before I do that, I have questions for you to think about for yourself. Since I'm with you for almost an hour, it's hard for me to do all the talking. So I was just curious about your experiences with what we call integrative medicine or complementary medicine. And maybe I'll define it first, which is the way that we define it personally at the center is evidence-based complementary medicine therapies that work in conjunction with traditional medicine. So we work with our patients to support the treatments that they're already getting using things like acupuncture or yoga therapy or massage therapy or things that you wouldn't find in a normal doctor's office. Have any of you, you can use your little Zoom hand or your regular hand. Have any of you been exploring these kinds of therapies? Okay, good. Some of you are working with it. Great. Have any of you had an interest but not known where to start? No, you know where to start. Good. Okay, good. So I hope today that you'll get a little bit of an idea of what we do at the center, and then also what maybe you're interested in pursuing, if there's anything out there. Please feel free to ask me questions. That little hand function is helpful. It'll zoom you right up to the top and I'll be able to see. I don't mind being interrupted. In fact, it helps me clarify probably what I'm messing up to start with. So let me share my screen next. Everybody good if I share my screen now? Okay, great. Okay, can you see what I got on the screen? Great. Okay, so that's me, but I want to make sure to acknowledge our medical director, Ron Glick. He has been the director of the Center for Integrative Medicine for the last 20 years. The center itself came into existence in the late 90s and he took over in 2002. He is a psychiatrist and a professor of physical medicine and rehabilitation. Let's go quick. Make sure that I can advance the screen. There we go. So like I said, it was founded in 97 and it lives in the Department of Psychiatry. And that I think is because Dr. Glick is a psychiatrist, but it also offers a really nice combination of the work that he does in psychotherapy, and he's able to bring some of these approaches into his treatment with patients. And he's been able to set a nice precedent for lots of the different departments across the University of Pittsburgh and in UPMC to start incorporating some of those approaches as they're seeing patients with behavioral health issues. But when we think about what brings somebody to see a psychiatrist, it's very typically things like depression, anxiety, trouble sleeping, or relationship problems, all of which can happen regardless of your health condition and sometimes because of it. So it's been a really nice home for integrative medicine. Moved to its current location, which is just around the corner from Shadyside Hospital, a bright and airy space, and we're allowed to have real plants and tanks, which does not happen in many of the UPMC facilities. And we are involved in clinical care, education, meaning we are training doctors and medical students, and then research, where I come into. But you probably can imagine why patients would seek out complementary approaches to medicine. The conditions are chronic and long-term, and they're tired of the treatment. The treatment's not working. They're getting frustrated with the care that they have, feeling unheard, and wanting a better approach. And maybe they just have a preference for a more holistic orientation. That makes sense, right? Are there other reasons? Anybody else think of another reason why, or have another reason why they might want to seek a different approach? I can't really see everybody actually now that I'm sharing my screen, but I'll trust that you agree. Can you tell I used to be a teacher? It's hard for me not to get my face in there and see everybody. Okay, we see approximately and above about over 8,000 outpatient visits per year. Our demographic is typically 25 to 65 years, and do see a lot more women than men, as you might expect if you've ever been to a yoga class. Happens to usually be a lot more women than men, but I see that changing. I see that it's being accepted across the board a little bit more. The primary complaint is pain. Others, mental health or general health problems. And most patients with pain, as you might imagine, also have a sizable amount have depression, anxiety, insomnia as well. So the Center for Integrative Medicine seeks to work together. So Dr. Glick and his team, which I'll explain a little bit more, have several different approaches to help ease and create a plan of care for all of those symptoms, not just one. So one of our largest programs, and one that has been grown since the center's inception, is our Mindfulness-Based Stress Reduction class, MBSR. And this is our research director, Carol Greco's pet project, and she's been working on it for 20 years. Thousands, I would say over 1,000, but thousands, I'll say it, have gone through the program over these last years. And it was, the MBSR itself was born out of Boston at the University of Massachusetts with John Kabat-Zinn. A lot of his work has translated some of the oldest practices into something more acceptable by Western culture. And so the practices that he has championed and that Dr. Greco teaches here at the university really have been used in medical settings for many, many years. And so her trainings, well, teacher trainings, but also her courses are often paid for by employers now, which is pretty exciting. It's an 8-week course, and you can find much more information about this on our website. But they're paid for by employers and really well attended. There's benefits for mood, anxiety, sleep, pain, et cetera, and we'll do a practice after I'm through all this spiel in a minute. But these practices, as you are well aware, are expanding across the world and into corporate settings, into school settings. LeBron James has his own meditation channel. Everybody is working with some of these practices, and it's really exciting that Dr. Greco offers it here in the city and at the Center for Integrative Medicine. She also does teacher trainings as well, which is a much more intensive program, but also really, really neat. So let's get to the good stuff. So if I were to put a whole list of our services, they would take up the entire slide. But I would like to highlight these 4 services in terms of what I think would be most beneficial to supporting your cancer care. Acupuncture, massage therapy, structural integration, and naturopathic counseling. I'm actually going to start quickly and just kind of touch upon the last 3, because the acupuncture is what I'd like to concentrate on today. But our naturopathic counselor, Kara Lucius, is fantastic. She's been working with patients for many years and is running her own research study that I aid her on, looking at how patients undergoing immunotherapy are also using supplements to support their health and well-being. She's assessing that so that she can make more informed decisions when she's counseling her patients. She uses a nutrition approach, a supplement approach to help guide patients through their care. Structural integration, I would say, is a combination of yoga therapy and chiropractic work that is being done. And we also have a fantastic massage therapist. Her name's Jessie, and she herself is a survivor and has worked with patients who have cancer or are recovering from cancer for many, many years. She is a wonderful massage therapist. So if that is something that you're interested in, she is very used to that work, and I'm excited to provide that service for folks. Acupuncture, as I'll get there, I have many slides on acupuncture. Am I going too fast anyway? Anybody have any questions so far or yet? Okay. So let's get to the acupuncture. So I am, well, let's wait. Let's talk about other people's stuff first. The integrative pain management and integrative psychiatry, that's Dr. Glick's baby. He works with our PA, Leslie Lassoon. I hope I'm saying her name correctly, Leslie Lassoon, to adequately treat and hopefully create more of an integrative approach to managing pain and also mental health issues. So that's Dr. Glick's specialty. Insurance does cover some of these treatments. Chiropractic care, of course, all medical services by Dr. Glick and Dr. Lassoon are covered. And acupuncture is covered by UPMC health plan for some conditions, which is where the research comes into play, right? So the research is being done so that we can make a case for these services and approaches as being an integral part to care. And we are hoping to increase the knowledge about the safety and, of course, the effectiveness and usefulness and the way patients tolerate it, the way it can benefit them, so that we can support that work as it moves out into the greater health system. Integrative modalities may not be typically and haven't been subjected to the same level of scientific inquiry as most Western medicine treatments. I'm not exactly sure how I feel about that. Sometimes I feel like we shouldn't have to all be subjected to the same level of scientific inquiry. If we know it works, it works. But without that kind of data behind it, we can't support it in a hospital setting. And that's what we're hoping to push forward. So without further ado, a little bit more about our trial. There is a trial of mindfulness for and other treatments for chronic lower back pain called the PAC-BACK trial. The last 4 are studies I coordinate. So functional medicine, which is essentially using nutritional supplements and diet changes to aid and treat autism spectrum disorder symptoms. Inositol, which is a nutritional supplement to treat anxiety in youth that have bipolar disorder. Traditional anxiety medications typically can trigger bipolar symptoms. So using a nutritional supplement to treat that anxiety is hopefully a more beneficial way of stabilizing those with both symptoms, with those comorbid diagnoses. Like I mentioned, Dr. Lucius studied supplement usage in immunotherapy patients. And finally, acupuncture for pain related to advanced cancer. And that is the study I'm going to talk about right now. Here's our flyer. Has anyone seen it? I hope all of your doctors are handing it out all the time. If not, here I am to hand it to you. So I will get into the specifics a little bit more at the end, but this is what our flyer looks like. And it's adults with pain related to their cancer and are currently getting treatment. You don't have to be in treatment at a UPMC facility. We would like to be able to communicate with your treatment provider in order to make sure that the acupuncture is safe for you. All the sessions are free. Parking on site is free. The questionnaires are short and sweet, not too hard. I'm probably not allowed to say that. They're questionnaires on an iPad and they're not too difficult, but they are part of the study. And I wanted to tell you a little bit more about acupuncture. In this big green bubble, it's the quick definition is that it is the practice of inserting needles into specific parts of the body and can be helpful for pain, nausea, fatigue, and other physical symptoms. I will come back to all of these contact points, so please don't worry too much about jotting everything down. I'm going to zip past this slide for a moment. I'll come back to it. I want to talk a little bit more about acupuncture. Like I said, it involves inserting those needles into precise points, and they are called acupuncture points. Now, in other practices. They may be stimulated with electricity or heat, but we're not looking into that in this study. This study is looking at how a specific method called the balancing method is useful for pain. Typically, the needling causes a little pinching, but otherwise is not painful. I'm here to attest to that being the truth. I've had a few sessions with our wonderful acupuncturist, and once they're placed, they're pretty pain-free. And I'm just going to read this, but according to the traditional Chinese explanation, illness results from blockage of the flow of energy through the body. According to this tradition, the use of acupuncture helps to open up the flow of qi and restore balance to the system. Western medicine explanation is that acupuncture needles send a mild pain message to the brain. The brain responds by sending a pain relieving message electrically and chemically back to the body. So 2 different stories, 1 result, right? In the end, do we need to know the exact explanation or reason why? No, but we hope that it really does help. And so this research study is helping us understand if we can pinpoint points and acupuncture points that might help alleviate pain as a result of cancer. So I wanted to show you some pictures of the points being inserted, the needles. They're very, very small if you haven't had it before. This is KK, one of our providers, but he is sort of a backup on the study. Tricia Smith is our acupuncturist, and she's pretty wonderful also. So you can see the needles are really quite small. You can almost not even see where they're inserted. They very rarely do cause any bleeding, but just maybe a tiny little prick. And I wanted to share one particular story that highlights some results of acupuncture treatment for somebody who was still experiencing pain. So the title is Feel Like I Can Dance Again. A woman in her mid-40s had surgery and chemo for breast cancer and was now in remission for approximately 1 year. She began having a surgical scar area pain along her rib cage and generalized bone pain throughout her whole body while going through chemotherapy. But the pain continued after she completed chemo. She complained that her bones felt like glass, and she had stiffness and constant deep achy pain throughout her whole body. This was very distressing to her since she was a former dancer. She was also very anxious and didn't sleep well due to pain. She came to acupuncture after finding out about a research study on acupuncture for cancer-related pain. She joined the study and received 12 treatments. She noticed short-term reductions in her pain levels after the 2nd session. By the 8th session, she reported the glass sensation had disappeared and she felt like she could dance again. She completed all 12 of the sessions of the study and by the end was reporting 0 to 1 out of 10 pain levels and significantly lower anxiety. So that is definitely a success story. As we know, not everybody's experience with acupuncture will be the same, but this is our hope, of course. I think that was my last slide. So let's go back. I want to hold this up here for a little bit so that you could write down my email and my phone number if you choose to. I'll also make sure Wendy has plenty of these so that when you come for your Valentine's Day dinner, you can pick one up if you forgot about us and if you're interested. I do have some practices I would love to share with you, but before we do that, I wanted to make sure to give you some time. I'm going to stop sharing now if that's okay. I wanted to give you time to ask me some questions, and I'm happy to answer questions about the study, and if you feel like you would qualify, I'm happy to answer that, but I know that Wendy might want to stop the recording to be able to do that. Wendy, are you going to stop for all the questions, or
are you going to do any are you doing any
practices?
Yes.
Sure, I can do practice before questions if you want.
Yeah, that would be great if you could do that. Then I'll stop it and we'll do the questions after.
Okay, everybody, write your questions down.
Yeah, yeah. Be thinking of them, and you can do them in the chat for sure. If you want to put them in the chat now, you certainly guys, you can do that for sure.
Okay, great, Jill. We will not forget. Yeah, so yeah, make sure you think about your questions. We will definitely answer them, but I want to make sure to do a little bit of a practice with you before we go any further. So this is one of my tendencies is to, when I feel a little bit of anxiety, is to talk faster, as probably is pretty typical, but also to try to be funny, like I crack jokes and to be very self-deprecating. And so that could be kind of distracting, and then I lose my focus. So I kind of got rolling with everything before stopping and pausing and doing the exact opposite of what I was hoping, which was to do a practice with you. So mindfulness is something that is a bit of a buzzword these days, right? I'm sure you've all heard the word mindfulness, and you've all been inundated with, practices to help improve just about everything. But at the very basic level, mindfulness is really about just pausing. It's creating a space between the thing that bugs you and your reaction to it, if I'm being quite blunt, right? It's about creating just a little bit more time before you react. And John Kabat-Zinn and the other practitioners of MBSR would define it as purposeful awareness in a non-judgmental way. So paying attention to what comes up and not judging, being fully present in the moment. I'm reading yours, Tina. I appreciate it. I taught mindfulness and yoga to children for 15 years. So my way of defining it is stopping. Just stop. Stopping, learning to pause before you react. And this is it comes in handy in so many ways, right? It comes in handy in your internal monkey brain. It comes in handy when interacting with other people. It comes in handy when you're laying on the horn or thinking about just slamming on the brakes and laying on the horn. And so it's something that requires constant work, right? One of my teachers defined mindfulness as simply not forgetting. Now we're remembering to remember, okay? And what I ask you to do as we're sitting here breathing, because that's what we're going to do, is to be really gentle with yourself. This is when the non-judgment comes in. Yep. So when you notice your mind wandering and you notice yourself getting annoyed by the practice or annoyed by my voice. I think I have a pretty calm voice, but it can get annoying when I'm giving you direction. To be non-judgmental in that, to notice if a feeling comes up and then see if you can let it go. But more importantly, when I ask you to pay attention to your breath, you're just going to imagine that you're chums with your breath. Just gonna wrap your arm around your breath and bring your back in. Come on, attention, just come right back in. Just come back in for another one. So that's kind of like the mindset that we'll try to cultivate as we take a few moments to breathe. Okay, but before we do that, because I personally am like a very agitated human, I need to move my body a little bit before I can make my body still, which is pretty much yoga, right, Joanne? Like yoga was invented so that we could sit still for a very long time and meditate. That's kind of how I think about it. So we're not going to do too much movement. We're going to do just a little bit. We're going to breathe in and lift our shoulders up, and then breathe out and then let them get heavy and drop down. Make your neck nice and long. And then do it again. Breathe in and up. And breathe out and down. This time, pull those shoulders way up to your ears as you breathe in and send them back and down, opening your chest. Breathing in through your nose. And you can breathe out through your nose or out through your mouth, whatever feels good. And we'll do one more. In and up, out and down. And don't forget the first rule of all of these practices, which is listen to your body first. So if any one of my directions makes you feel uncomfortable, either in mind, heart, or body, just don't do it. Make up one that works for you. That also is fine. So we're going to bring our fingers up and interlace our hands in front and flip our hands. And we're going to push our hands away or towards the camera, I guess, right out in front of you. Maybe parallel with your shoulders if that works. If you need to go down a little bit, you can do that. And then we're going to tuck our chin and round our back so that you're really curving your spine, letting the back of your body stretch. And then if you're able to keep your hands interlaced and your pinkies and your thumbs touching, looking up towards the ceiling and pressing your hands up towards the ceiling as well. So now this should be like a big back bend, a big arch. It's almost like doing a whole wheel pose, a big back bend, but you're not really, it's the same benefit. We're going to add our breath. Okay, so as you come down, you'll exhale, round your back, let your ribs curve in, and slowly come back in as you inhale. Open your rib cage, take a big, 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 big breath, and then let it out as you slowly come down, round your back, round your back, round your back. And one more time, all the way up, breathing in, and then let your fingers release and maybe come down, sparkle your fingers down. And if you're sitting on a chair or on the couch or on the floor, you're just going to rest your hands on the chair next to you. So you use them for support. So what I'm doing is leading you through the different positions of the spine. So every yoga pose is one of the 7 different positions of the spine. So when you're sitting nice and tall, not straight, of course, because you know your spine has all those natural bends in it. You're sitting nice and tall, that's just a neutral spine. We did a nice forward bend when we rounded our back, and then we did a nice back bend as we lifted our arms up. So next we're going to do like a side bend, a C curve. So I'm going to prop my left hand down, and I'm going to lift my right arm up. So it's kind of one down, one up. And I'm going to reach all the way across. So I'm using my hand on the seat for a little bit of support. You can bend your elbow if you want to go deeper and deeper and deeper. We're just kind of creating a lot of space on our right side rib cage. And while we're getting a little closer on our left side, we're not collapsing into that rib. Try to take a big deep breath and hold this pose. Use your arms to support. And then as you exhale, come all the way back up. Drop both hands down. And then we'll drop our right hand, prop ourselves up, reach our left arm up, and then take a C bend in the spine. Moving so nice and slow. It kind of feels good to do it, to move slowly every once in a while. And then come all the way back down. All right, so we've hit 5 directions. Does anybody have a guess on what the last 2 are? Joanne, you're not allowed to answer. I bet you can guess. Yep, you got it, Jill. Twist. A twist. Yep. So we're going to take our right arm across to our left knee. And essentially this twist is just turning our shoulders off the same line as our hips, right? So I'm looking over to the right side. I'm going to keep my chin just in line with my heart. If I want to move my cervical spine, I might turn my chin a little bit more towards the left shoulder. I don't have to though. I get a nice twist right here in the center of my back. The one that feels the best for me is up here behind my heart and my rib cage. That's where it's nice and tight. Slowly untwist yourself. Come back to the center. Little wiggle, pull that nice and straight. And then let's go to the left side. Or I'm sorry, we're turning to the left, but my or turning to the right, but my left arm is guiding me. Whatever, just do the other side. You can add your neck in if that feels okay, but don't jar. And then come all the way back into the center. Ooh, I can really drag out some stretches, can't I? But moving slowly and with a bit of intention, creating a pause between a breath and between the movements is just a way of being mindful and paying attention. Okay. I'm going to try ringing the bell. Sometimes it doesn't work so great on Zoom. Sometimes it kind of cuts in and out, but I'll try it so you can hear it. This is my favorite bell. I've used it for many, many years in the classroom and here in my therapy sessions and group therapy with some of the kiddos. They also come in small, but that one's a little more annoying. I like the sound of the big one a lot better. So here's how I practice the bell. I ring it, we listen, and we listen, and we listen. And when it stops ringing, you kind of signal that you know that. If you're off camera, just signal to yourself. If you're on camera, you can raise your hand or thumbs up. It doesn't matter. Okay? I'll explain in a minute. I hope you hear it. Okay. So were you able to hear it extended or did you just hear the ding? Okay, it never works. All right, so it never works on Zoom. Can you imagine trying to do this Zoom yoga with kids during COVID? It was like, oh my, I just mute. Now follow me. That's what I did. It was kind of a disaster, but we all survived. So the bell practice, it usually rings for about 10 seconds. And the reason like you listen and listen and listen, you could do this with a ring app on your phone, or if you have a bell of any sort at your house, any sound, to be honest. I ring it so that I remember to pay attention. And I pay attention and I pay attention. And it's like 5 seconds and then I'm done. But those 5 seconds, all of my attention is focused on the sound of the bell. That's what the bell is used for. It's kind of like a warm up to get your brain ready to pay attention. Okay, let's try one more time, see how long you can hear it. I actually don't know where.
You know what, Lee, I think when you just did it the second time, I could hear it better than the first time. So where you're holding it there for some reason was better than down to the right.
I think it's because I'm talking at the same time. I think it's picking up the sound of my voice, but not the sound of the bell. Okay. So I'll try it again. Where was I holding it? Down here? I don't know. We'll see. Okay, here we go. I'll ring it. Maybe I'll talk and I'll sing the ring. I'm not singing. Here we go. Ready? It's ring and ringing and ringing. All right, so that worked a little bit better. So the sound of the bell, now we've kind of grounded ourselves, we're a little quieter. So if you can now, find your sitting bones on your seat. And that really just means notice your legs, where they are, the back of your legs. Bye, Odette, thank you for coming. And then find your tall spine. So it's that first position of the spine where you're extended as much as you can, feel comfortable. If you're in a seat with a back and it's a tall back, that's fine, but maybe try to engage your core, your abdomen, your back, your shoulders by moving away from the back of your seat a little bit. And then we're going to notice your feet wherever they are. Maybe they're on the floor or maybe they're crossed underneath you. Just notice where your feet are. Now notice where your hands are. My hands just go smack down on my thighs. I like to feel connected. You might decide to cup your hands or bring your fingers together. That works too. And then notice what your shoulders are doing. Are they close to your ears? Are they down here? Either one. is fine. And just maybe take a breath and loosen those up a little bit. And then notice your face. Notice if you have any tension in your forehead or your eyebrows. And if you're able to let go of that a little bit and let your eyes fall closed, go ahead and try. You're welcome to keep your eyes open, although there's nothing to see on the screen. Maybe just focus on a point off the tip of your nose. And let your vision go a little fuzzy, a little blurry, so you're not focusing on any one thing. And you'll hear the sound of my voice throughout, but you want to be present in the room that you're in. So we'll start by first noticing things in your room that you hear. Maybe you hear the ticking of a clock or the busyness of a family. Maybe you hear the vent. Maybe you hear a fan. See if you can notice things far away from you, noises far, far away. And then bring your attention a little bit closer. Notice if there's any sounds close to you. And then see if you can notice the sound of your own breath. Maybe you hear a little rustle as you inhale. You can hear it entering through your nostrils, or as you take a big deep breath all the way down into your belly. Maybe you let out a big breath with a big sigh. And then once you've heard a few of your breaths, maybe just try to focus on how they feel. Maybe you feel the cool air rushing in your nostrils or your mouth. And you feel your chest and your diaphragm and your belly expand. And then you feel the breath release. Your diaphragm lets it go and the air rushes back out a little bit warmer this time. Breathing in the cool room air, letting it filter through your nose, move through all the lobes of your lungs, expand into your diaphragm, and then rush out. Take a few more easy breaths, noticing. Notice the sound, the sensation. You might become aware of the sounds in the room or the sounds outside the room, and see if you can, this is the time to throw your arm around your attention, just gently guide it back to your breath. Just come back and remember. Your mind will wander. You will forget. You will forget every single day to remember. And every time you remember, you see something new, or feel something new, or hear something new. Let's make our breath a little bit bigger, in through your nose and out through your mouth with a big sigh. We'll do 2 more like that as you start to wiggle your fingers and your toes. And 1 more big breath all together, breathing it all in. Letting it all out. And if your eyes are closed, letting them flutter open. Hello. Woof. I don't think I've sat that still in quite some time. Thank you for helping me. Thank you for helping me. So that was a quick practice. Well, it wasn't that quick. We did a little movement, we did a little noticing, and we did a little breath awareness. And those are a lot of the practices that I teach and that are taught in mindfulness-based stress reduction and by practitioners at the Center for Integrative Medicine. So thank you for practicing with me. And maybe you want to sit in quiet. Maybe you want to ask some questions. I'm good with whatever. I don't have a hard stop. I don't know if everybody else does, but I can stay